Hello, this is Kim Jong-il. Today's subject is part 1 of the upper second molar extraction. In differential diagnosis, anterior discrepancy signifies problems in the anterior teeth, and posterior discrepancy indicates problems in the posterior teeth. That is, premolars are extracted to treat anterior discrepancy, and posterior teeth are extracted to treat posterior discrepancy. The problem with premolar extraction is that if the 4 third molars are extracted as well, a total of 8 teeth are lost, resulting in only 24 teeth in the mouth. The patient hopes to maintain as many teeth as possible. Therefore, the primary option is the extraction of third molars, followed by the extraction of second molars. Of course, the first molars can be extracted, but only under special circumstances. In case of posterior teeth extraction, the primary treatment option is the third molar extraction. However, in some cases, the extraction of second molars can be considered as well. Only if the third molars are in a favorable condition because they have to replace the extracted second molars. The first molars can be extracted if they are severely decayed or extensively restored. In this case, rather than the premolars, it is better to extract the first molars. And the third molars have to be in a favorable condition so that there are still 28 teeth in the mouth after extraction. There is a lot of controversy over the pros and cons of second molar extraction. Those who advocate claim that the upper second molars have subtle role in occlusion, especially in protrusive and later ottrusive movements. Also, in many cases, the extraction of second molars makes the orthodontic treatment easier. On the other hand, those who are against insist that there is a high chance of abnormal eruption of the third molars, and that the 4 molars are more important than the third molars. In any case, it is important to first assess whether the third molars can erupt favorably or not. Teeth 17 and 47 were extracted in this patient, and teeth 18 and 48 erupted. The development of third molars should be evaluated, and it is different for the upper and lower third molars. According to Quinn, 75% of the third molar will achieve mesial contact after extraction of the second molars. Maxillary third molar rarely need to be repositioned, but mandibular third molars are more likely to need uprighting and repositioning. That is, extraction of the upper second molars can be managed relatively well, but caution should be practiced for the extraction of lower second molars. It is important to assess the third molar condition. So, what should be evaluated in X-rays? The size, shape, and calcification should first be considered. It is inappropriate to extract the second molars in the absence of the third molars. The angulation and eruption stage should also be evaluated in order to decide on the timing of extraction of third molars. Then which of these X-rays provide better information about the third molars? The molars become magnified in panoramic X-rays. According to Song, the vertical magnification of maxillary molars is about 1.2, and according to Rauf, the horizontal magnification is about 1.2 as well. Therefore, it is appropriate to evaluate the tooth size in cephalometric X-ray because it is magnified in panoramic X-ray. The size, shape, and calcification of the third molars should first be evaluated. Good upper third molar condition means comparable size, shape, and calcification to those of the second molars. In normal development of the upper third molars, they lean distally and then mesially during eruption. On the other hand, the lower third molars lean mesially as they erupt. The upper third molars have downward and forward eruption path and rotate or tip mesially during eruption. This eruption path should always be kept in mind. Indication for the extraction of maxillary second molars is if the maxillary third molars are developing in the normal sizes, shapes, and dimensions, and if the axial inclinations are 30-45 degrees to the adjacent second molars. If there is a posterior discrepancy with A, short distance from the mesial surface of upper first molar to PNS, B, 60 angulation of the upper first, second, and third molars to the occlusal plane, and C, 30-45 of axial inclination of the third molar to the second molar. The extraction of upper second molar does not require bonding and repositioning of the upper third molar. When is it good to extract the upper second molars? As for the third molar, a good timing is when the crown has formed and the root is beginning to develop. So in this patient, it is better to delay the extraction for some time. Then in what condition should the upper second molar be? It is good to extract the upper second molar when it has erupted or is about to erupt. That is, the optimal timing of the upper second molar extraction is when it has erupted and the root development of upper third molar is initiated. According to Wheeler, the mean age of extraction of the second molar is 14.7 years. Average eruption time of the upper second molar is between ages 12 and 14. Final crown formation of the upper third molar takes place between ages 12 and 16, and mean interval for eruption is 3.1 years. In other words, the best timing of the upper second molar extraction is after it has erupted or is about to erupt. If the upper second molar is extracted too early when it is still in eruptive phase, there is a high chance of impaction of the upper third molar. On the other hand, late extraction of the upper second molar, when the upper third molar is in eruptive phase, is likely to result in an open contact between the upper first and third molar. Therefore, if the angulations of the upper second and third molars are small, it is good to extract the second molar a bit early. If the angulations are large, it is better to delay the extraction. The condition of upper third molar is of utmost importance in case of the extraction of upper second molar. The size, shape, calcification, angulation, and eruption stage should always be evaluated. And we need to be able to recognize the specific malocclusions that are good indications of the upper second molar extraction. This is a class 2 malocclusion with large overjet. If the upper second molar is extracted, the upper dentition can be distalized, and the upper third molar can erupt in place of the upper second molar. In many cases of class 2 malocclusion with anterior crowding, the angulation of the upper incisors is either normal or lingually inclined, and it can be worsened if the premolars are extracted. In class 2 malocclusion with excessive overjet, the canine key must be assessed. The indications of upper second molar extraction are good third molar condition, acceptable profile, and no or minor crowding in the lower arch. In this case, the upper arch can be aligned by utilizing space provided by the extracted upper second molar. Only when these three indications are met, the upper second molar can be extracted. However, there are not that many cases, but it has to be kept in mind as a treatment option. The first indication is good third molar condition, which includes size, shape, and position. The contraindications are 1. The third molars are small, malformed, or absent. 2. The third molars have already erupted. In this case, it is appropriate to extract the erupted third molars. 3. When the axial inclination of the third molar to the second molar is less than 25 degrees, because there is a high chance of impaction of the third molar. The second indication is acceptable profile. Protrusive lips are a contraindication and may require premolar extraction to treat. The third indication is no or minor crowding in the lower arch. What happens in an upper second molar extraction case if there is a crowding in the lower arch? The lower incisors become labially inclined as they are aligned. In addition, Class II elastics can be used to adjust occlusal relationship. And as a result, the lower incisors are even more likely to be labially inclined and become unaesthetic. Therefore, lower anterior crowding is a contraindication of extraction of the upper second molar. Let's review the indications of upper second molar extraction. 1. Good aesthetic profile. No severe crowding in the lower arch. 3. A retrognathic skeletal pattern with a potentially poor mandibular growth and small posterior vertical dimension. In this case, extraction of the upper second molar allows forward movement of the mandible. 4. In cases of a poor response to Class II treatment or limited mandibular forward movement. 5. If there is a strong relapse tendency after a non-extraction Class II treatment. 6. In cases of a strong anterior component of force in the posterior segment that causes mesial angulation. 7. In case of a deep caries lesion or a poorly calcified crown of the second molar. 8. When there is a very small space in the tuberosity. Chung's study compared Class II upper second molar extraction group and Class II non-extraction group. There is not a big difference in APDI, but there is a difference in ODI. What does difference in ODI mean? Compared to sufficient ODI 79 of Class II non-extraction group, ODI is a bit smaller in upper second molar extraction group. Therefore, CF is smaller 150, indicating small posterior vertical dimension. In premolar extraction group, the mandibular plane angle becomes steep, and as a result, the lower incisors are further labially inclined. The extraction of upper second molar is indicated especially in case of wedging effect, which is characterized by low ODI, APDI, and CF, small posterior vertical dimension, and negative palatal plane high ANS and low PNS. Extraction of the upper second molar can be performed in both Class II and III malocclusions. If PVD is small in Class II malocclusion, the forward movement of mandible is likely to be limited by the upper second molar. In this case, by upper second molar extraction, the mandible can move forward, and the upper dentition can move posteriorly at the same time. In Class III malocclusion with anterior crowding, the backward movement of mandible is limited by the upper second molar. And there is a high chance of labioversion of the upper incisors during alignment. In this case, extraction of the upper second molar provides space for alignment with minimal labioversion of the upper incisors. What are the advantages of extraction of the upper second molar? 1. The treatment duration is reduced. 2. Provides a better opportunity for the mesially tipped upper first molars to upright distally. 3. Require very little lingual root torque for the incisors compared to premolar extraction. 4. Maintenance of a better aesthetic profile. 5. Reduces the possibility of third molar impaction. 6. Reduces post-treatment relapse tendencies. 7. Provides better contact points in the premolar area because premolar is not extracted. There are some disadvantages of upper second molar extraction. Since the extraction site is far away from the upper incisors, upper second molar extraction is not much efficient in case of upper anterior crowding. Even after the extraction of upper second molar, there is a possibility of third molar impaction, and additional orthodontic treatment is frequently needed. Kim studied pre-treatment characteristics of adolescents with Class II malocclusion treated by upper second molar extraction. In measurements of skeletal pattern, no anteroposterior measurements and proportions of various vertical dimensions were significantly different. Particularly, the upper second molar extraction group exhibited extrusion and more mesial angulation of upper first molar and distal angulation of upper second molar. In other words, upper second molar extraction is indicated when upper first molar is extruded and mesially angulated due to posterior discrepancy. Then what should be considered in retention method? The contact between the lower second molar and upper first molar must be present. As already mentioned, the upper third molar takes 3 years to erupt after the extraction of upper second molar. During these 3 years, the lower second molar should not be over-erupted because it will worsen Class II malocclusion. In order to prevent this, the contact between lower second molar and upper first molar should be assessed. In addition, it is advisable to include an occlusal stop on the lower second molar in the removable retainer to prevent extrusion. In this patient, there is a slight lower anterior crowding and linguoversion of the molars. The profile should be evaluated, and if it is acceptable, the condition of upper third molar is assessed. If the upper third molar is in a good condition, extraction of upper second molar and lower third molar should be considered. Thank you for watching.